In a joint effort to prevent what is a highly treatable form of cancer, the UH Cancer Center is teaming up with Excel to get the word out about prevention. And Jill Kuramoto joins us for more on this. Jill?
Good morning, Kenny. May is Skin Cancer Awareness Month, and did you know that here in Hawaii, it's one of the most common cancers, but it is the most treatable. The trick is that you got to detect it early and you got to treat it early. So this morning we're at the UH Cancer Center, and we're going to be talking with Dr. Kevin Dawson. Dr. Dawson is the past president of the Hawaii Dermatological Association, and he's also with Queens. And we're going to do a quick exam today, right? And
we can do a quick exam of your sun-exposed areas.
Okay, right.
Normally somebody would be completely undressed for a proper skin examination.
But this is a morning show, it's a family show, so.
Right.
Okay, so tell me about what you're actually looking for when you do an exam.
Well, when we're looking at for skin cancers, we're actually looking for anything that's really changing on the skin. So your awareness is important as well. But we're looking for dark spots primarily, anything that has any kind of change or color change or border change. You can remember your ABCDs. ABCDE actually. A stands for asymmetry. If it has an asymmetrical border, and B stands for border. If it has any differences in color, that's the C. Diameter is 6 millimeters or more. That's about the size of a pencil eraser, about 1/4 of an inch. And E is evolution, so that's where the patient comes in. That's where the person comes in. If you notice something changing, that's an important risk for skin cancer, and that's something that you should bring to the attention of your doctor or your dermatologist.
And so what I understand is that it actually starts very young. I mean, normal skin cancers are can actually start
right.
Well,
the skin cancers in young people are rare, but we know that ultraviolet rays are the primary risk for skin cancer, and that exposure starts early. The damage is cumulative. It happens over a lifetime, and between 50 and 80% of that damage happens before a person's 18. So with our kids, we need to be protecting our kids. We need to be educating our kids and letting them know how they can protect themselves, and letting them know what the risks really are.
Okay, so for me, I'm looking okay. You don't see anything?
You've got a very few sunspots.
That's good. We won't talk about the wrinkles or anything like that yet. All right. Thank you, Dr. Dawson. Now, coming up in the next half hour, we're going to take a look at some of the campaign that's going to be launching next week, these PSAs that are going to be airing on TV about skin cancer prevention, and how it's actually targeting the young members of our community as well, and how just if you know more about this, then maybe there's less chance of skin cancer growing in our community. We'll have that coming up in the next half hour. Back to you guys.
Jill, you don't have any wrinkles to worry about. And you don't have anything to worry about either.
I think I'm good for now.
Yeah. Well, coming up next, Hawaii's own steel guitar in the house, and we'll get a taste of what audiences can see at a special Saturday concert.
Then at 5:46, one of the world's biggest